Welcome to our Thursday evening training once again. From wherever you are receiving us, whether you are here on our continent of Africa or further afield, it's a warm welcome to you. I hope this finds you well and going about your business of making a positive difference in the lives of those you meet, especially in your own life. So for those who are joining us maybe for the first time or the first few times, once again, my name is Betty Oloo, a long-time Neolife distributor, and always very glad to be able to spend this time with you, sharing our products and how to position ourselves so that we are able to help those who come to us. And of course, I'm always very glad that you are able to take the time and spend your data in joining us for this training, which we hope and always work towards making beneficial for you in your personal capacity as well as in building your business. So as you might have seen in your invitation for today, my session is going to be about oral health, which I think is an important aspect of our health to look at, and also to look at how our products can help in maintaining oral health. So I think a lot of energy and time has been spent in talking about our dental health, but I think we need to look more in general about our entire mouth. So when we're talking about oral health, we are speaking not only about the health of our teeth, but also the health of our gum and our tongue and the hygiene of the oral cavity. So if you think about it, our mouth is the only opening in our body that does not have a tight muscle to close it, and one where we keep on opening to put things, opening to talk. And because of that, it can be an entry point of bacteria. It can be a place through which harmful items might enter our system. So for that reason, hygiene is very important for our oral health, but also our general health. In fact, research has indicated that oral health plays an important role in our overall health and can be a predictor about our health further down the line. So if our oral or dental health is poor, it can be an indicator about other health issues that we have, and maybe we'll touch on one or two as we go along. Also thinking about the fact of loss of teeth. When we lose teeth, there are several negative effects that come from losing our teeth. Apart from not being able to chew our food properly, it can also lead to loss of confidence. And also it becomes harder to maintain oral hygiene when we lose teeth, because the gap in the mouth can be an entry point for infection. But also when we think about it, the enamel of the teeth, the outer covering of the teeth, and the inner one, the dentine, are the hardest substances in our entire body. So when we see these very hard substances starting to decay and fall apart, it means that there's a serious assault on our bodies. And so when we see, for instance, that our young children are having tooth decay and losing teeth, or even as we grow older, we ourselves get tooth decay and lose teeth, it should indicate that the substance that we are putting in that is leading to teeth decay is a serious assault on our body, and we should adjust our lifestyle habits to eliminate it. So for that reason, I'm going to speak about 3 or 4 different aspects of oral health. And the first one is saliva. Quite often we don't think about saliva, but saliva is a very important substance in our oral health, but also in our digestion, because remember, our digestion starts at the mouth by the chewing of food and the lubrication of the food using our saliva. And in fact, the initial parts of digestion take place in our mouth. So the saliva relies on the helpful microbes. So let me just backtrack. You remember that we are always speaking about our gut microbiome, which are the friendly microbes that live in our guts. But we also have an oral microbiome, that is friendly microbes that live in our mouth and support our oral health. As well as that, we have got harmful microbes that can enter our mouth and proliferate there and contribute to poor oral health. So saliva is very important, not only in the aspect of digestion, but also in the aspect of our oral health. It contains proteins and minerals that support the strength of our teeth and our gums. So remember, our oral cavity also contains the gums, which are the ones that keep our teeth in place. So we have got the teeth grow out of our facial bones, but the gums actually help to anchor the teeth in place. So when our gums are not healthy, it can be the initial problem that leads to loss of teeth. So, so for that reason, saliva and the proteins and minerals that it contains are important in the strength of our teeth and the health of our gum. We need to produce enough saliva so as for it to be enough to do the job it's supposed to do. That is in lubricating the food before we swallow it and helping to facilitate chewing, but also in rinsing out our mouth and keeping the environment healthy. Then let us look at teeth. Of course, as I said, I think with our teeth, we get a lot of information about, I think when we go to school, we are always, one of the subjects that we often find our children are taught about are the health of the teeth. So this is fairly familiar, the dental hygiene and so on. But the thing that we might not be so aware of is the fact that our teeth are always getting remineralized or demineralized, meaning that our body has developed a means of maintaining the integrity of our teeth, the teeth material itself. And we can support this process of remineralizing our teeth, or we can disturb it. So maintaining a healthy pH in our mouth is what ensures that our teeth are not losing minerals. Because remember, when our teeth are losing minerals, they're becoming weaker. So the pH that is normal and best is close to neutral, just a little towards alkaline or a little towards acid, but it should be between 6.7 and around 7.3. So within that pH, our teeth will be in the right pH for remineralization. If, on the other hand, the environment in our mouth is too acidic or too alkaline for prolonged periods, then it causes our teeth to lose the minerals that they are comprised of. So, for example, if we are drinking acidic drinks, like many of the drinks we call soft drinks are actually more of the acidic type. And if we are sipping it, then we are sipping it slowly for a long period, then let's say we are in a restaurant and we are having a soda and we are drinking it slowly, then it means that our mouth cavity is going to be experiencing that acidity for a long time. And as that happens, if it is a habitual thing that we are in the habit of maybe sipping a cool drink as we are working or walking or doing other things, then it means we are exposing our teeth to demineralization, which disturbs the integrity of our teeth and makes it more liable to decay. So another thing is that remineralization of our teeth, the majority of it takes place during deep sleep. And this is another of the many reasons we are always mentioning for getting good quality sleep. So, so just to know that our teeth actually can be strengthened by our own body system or can be weakened by some of our lifestyle habits by losing the minerals in them. So then let us take a quick look at our oral microbiome. So we have the friendly microbes that live there, but we also have harmful ones that can come in and start multiplying and also live on our tongue, in our gums, or even within our in the deeper parts or recesses of our the roots of our teeth. So the mouth always contains microbes. This is something that we cannot eliminate. But I've said we have got friendly ones and we've got unfriendly ones. When we've got a good balance, then the friendly ones keep the population of the harmful ones down. And that means it is important for us to support the microbiome within our mouth. So tooth decay, which is also called cavities, is caused by bacteria, not so much by food, but by bacteria. And these bacteria particularly like sugar and starchy foods, especially starchy foods that have been milled or refined so that they can easily adhere to our gums or our teeth, where the harmful bacteria can find them and feed on them. And as they feed on sugar or on these refined carbohydrates, what they do is they produce acid as a byproduct. And it is this acid that they produce that corrodes the enamel of our teeth and causes small holes to form in our teeth. And these small holes can grow into what becomes cavities or tooth decay. So just to say that most of the microbes in our mouth is going to be friendly, but of course, as I said, they are problematic ones. And our aim is to keep up the helpful ones so that they can keep down the harmful ones. So the population and balance of the friendly versus the disease-causing ones is determined by two things. One of them is our diet. So as I've said, the harmful ones like refined sugar and refined carbohydrates. So we should see how we look at our diet and support our friendlier microbes. The second thing that determines the balance of friendly versus harmful is mouthwash. So you probably will be one of those people who like to use mouthwash. Certain mouthwash are not problematic, but quite a number of them are problematic because what they do is that they kill the friendly microbes or upset the pH of our mouth. Because remember, we say that the mouth has a specific normal pH that it should have. So when you are using a mouthwash, it should be because it has been prescribed to you by a doctor for a reason, not simply as a habit to freshen your breath. Because using a mouthwash to freshen your breath is dealing with the symptom rather than the problem itself. So when we have bad breath, we should find out the root cause of the bad breath. It could be because we are missing teeth. It could be because our dental hygiene is not so good. Maybe we don't floss and clean between our teeth very well. Or we have habits such as cigarette smoking or other such habits that can contribute to bad breath. So rather than using mouthwash as a means of freshening your mouth, get to the problem of why there is bad breath and only use mouthwash. Let us say if you have experienced some infection in your mouth and the doctor has recommended the use of mouthwash. Otherwise, at other times, what we should do is mind what is in our diet and also ensure that we are maintaining dental hygiene. So let us look at some other lifestyle points. So one of them is that breathing through the mouth is a problematic thing. Remember just now I was talking about using mouthwash to freshen our breath. One of the things that leads to bad breath is habitually breathing through our mouth. So we are supposed to breathe through our nose, and we only breathe through our mouth, let's say if we are having maybe very high intensity exercise that is causing us to lose our breath, and therefore we need to breathe through our mouth. But under normal circumstances, we should breathe through our nose and have our mouth closed, apart from when the mouth is in use, whether to eat or to speak. So the problem here is that if, let's say, when you're sleeping at night, we sleep with our mouth open, maybe out of habit or because we have blocked noses or blocked sinuses, then it makes our mouth become dry. And the dry mouth is one of the reasons for having bad breath, because not only will it upset the pH, but also it leaves our mouth open for unfriendly microbes from outside to enter our mouth and live there. And so having a dry mouth actually increases our risk of tooth decay, gum disease, and bad breath. So as much as possible to be in the habit of breathing through our nose. And if we find that we struggle to breathe through our nose, we should get to the bottom of the problem with the help of a doctor. It could be that maybe we have got some chronic infection or some chronic blockage or abnormality that is making breathing through our nose difficult. I know that if you have respiratory problems such as allergies, such as sinusitis and so on, these can contribute to difficulty in breathing through the nose. But rather than continue breathing through the mouth, the best recommendation is to get to the root of why we are not able to comfortably breathe through our noses. Okay, then moving on, another point I wanted to make is certain cosmetic items like piercing the lip or piercing the tongue. This increases the risk of poor oral health and can lead to gum and dental problems because the item, maybe a metallic item, is put where we have the piercing, and this will upset the microbiome of the mouth. It can also knock on the teeth and irritate the gums and lead to issues to do with poor oral health. Then I think I've already mentioned about mouthwash and why we should be cautious about using mouthwash, rather to use toothpaste and brush our teeth well, and also to clean between our teeth by flossing. You can floss using dental floss, or you can floss using toothpicks. You can use a string and so on to ensure that there is no food particles left in the mouth. Okay, then there are some people who like to whiten their teeth using teeth whitening agents that come in a kit that you can buy. Unfortunately, there is a debate about whether the teeth whitening agents are safe. Some are said to be safe, but others have been found to endanger the integrity of the enamel of the teeth. So if we are using teeth whiteners, it is important to take that into account. Certain illnesses can undermine our oral health by reducing saliva production, and also by causing us to need treatment that can harm the microbiome. So if we have got some of these illnesses, as I said, for instance, if we've got respiratory illnesses that make it difficult for us to breathe through our nose, or make it difficult for us to keep our mouth closed, then this can endanger our oral health. Then I also wanted to mention that gum disease and tooth decay has been linked to serious illnesses. For example, heart disease. One of the initial signs that all is not well with the heart can be the gum disease or dental tooth decay. Then also certain kinds of dementia, and also certain kinds of autoimmune illnesses like rheumatoid arthritis can actually been linked to dental decay and gum disease. So this is just to emphasize that we should take our oral health very seriously, because it can be the starting point of bacteria entering our system and causing problems further within our bodies. So a few ways of supporting our oral health, of course, is to avoid the problematic foods like sweetened drinks, alcohol, junk food, and so on, which feed the unfriendly microbes that lead to infection, whether of our teeth or our gums. And then, as I mentioned, good dental and oral hygiene is important. When necessary, maybe once or twice a year, you can visit a dentist to see if your teeth are all right, and if the extra cleaning as a result of plaque accumulation is necessary. But habitually, especially at night, making sure that before you retire, your mouth is well cleaned, your teeth are brushed and flossed, and that you are able to get a good night's sleep and to sleep with your mouth closed. These are all points that can help to keep down the population of harmful bacteria and minimize the risk of tooth decay and gum disease. On top of that, for our young children, we should not introduce added sugar to their food, especially before the age of 2, and even after that age, we should be cautious about introducing them to these problematic foods, because remember that when we help our children to start bad habits, we are setting them up with a struggle of later on trying to get rid of that bad habit. So sugar and junk food tend to be what we refer to as hyperpalatable, meaning that they are very tasty. And if we introduce them to young children, the children will shun healthy food and prefer the excessively processed foods and sweetened foods and so on. So rather to introduce young children to ordinary homemade food that does not have the chemicals and the additives that make them hyperpalatable. As they get used to this food, it will be easier for them to maintain habits that don't include junk food and junk drinks. Okay, expectant mothers should ensure that they get inadequate amounts of vitamin D, because vitamin D deficiency during pregnancy can contribute to increasing the risk of tooth decay in a child's life later on. So as an expectant mom, vitamin D is very important, because you'll also remember that vitamin D plays an important role in the absorption of calcium, and our teeth and bones are made mainly of calcium, as well as other minerals, but calcium is a big component of our teeth and our bones. So vitamin D is important there, not only for adults, but also for expectant moms to ensure that the baby is going to have what it needs to develop good, strong teeth. Prioritizing good sleep, as I've said, inadequate sleep interferes with tooth remineralization, which, as I've said, occurs during deep sleep mainly. And so our sleep is an important pillar of good health. Then let us look at our Neolife products, which will play an important role in our oral health. Again, I always think how often we don't think about our oral health and our teeth, except when we have toothache or when we have gum disease or our gums are bleeding and so on. But oral health is actually an important pillar of overall health. And so as we look at our Neolife products, there are important ones that should form part of our supplementation to maintain good dental and oral health. I will start with vitamin C. Vitamin C is important in the formation of collagen. Collagen is found in very many tissues in our body, and that, of course, will include our gum. And so healthy gums require that we have got a good amount of vitamin C in our diet. And so we can have that as one more reason. Of course, you will know that there are very many reasons why we should have enough vitamin C. It plays very many important roles in our bodies. That includes the laying down of collagen in our tissues, and that supports gum health. So number one, there will be vitamin C. Number two is going to be vitamin A plus D. Vitamin A plus D, remember I said vitamin D plays an important role in calcium absorption, and calcium is what is used to remineralize teeth. So A plus D will play a role there. It also, the A plus to prevent our mouth being dry and our gums getting inflamed. So vitamin A plus D there, another important one. Then the third one will be CalMag. We can also use multimineral alfalfa because it contains calcium and magnesium. So one of the two, or so you can use one of the two, and you can also use both if for one reason or another, you maybe as an expectant mom, you may opt for using both. So this will help in bone and tooth strength. So the CalMag or multimineral alfalfa will ensure that we have what we need for strong bones and strong teeth. Then we also will recommend either fiber tablets or acidophilus if you have it in your market. Fiber tablets as supplement to the dietary fiber that we take. Remember that the friendly microbes always like fiber, and the fiber could be from our diet, or we can supplement if we are not quite certain that we are getting enough fiber in our diet. We can always supplement with fiber tablets, and this provides food for our the friendly microbes, and these friendly microbes are going to help us by supporting our immune system and also keeping the population of unfriendly microbes down. So if you do not have acidophilus in your markets, by ensuring that you have got fiber in your diet and also taking fermented foods from your culture will keep on introducing friendly microbes in your system. So these friendly microbes is why I think any culture that you think of has certain foods that they ferment. It might be porridge that they ferment. It might be milk. It might be vegetables. All these were developed because these microbes play a very important role in our health, and that includes our oral health. If you have been sick and needed to take antibiotics, once you finish the course of antibiotics, it is very important that you do everything you can to restore the gut microbiome and the oral microbiome, either by taking acidophilus or by using the probiotics and prebiotics that you'll find in fermented foods that are part of our different cultures. Then I see I have a minute or two left. I wanted to mention what we can recommend for gum or gum disease, or what is sometimes called periodontal disease. So here we recommend vitamin C. Often I will say you can use vitamin C or you can use flavonoid complex. Flavonoid complex contains a small amount of vitamin C and other very important plant nutrients. So you can use those as a first recommendation. We also recommend omega-3 salmon oil and vitamin B complex. Again, remember the lifestyle issues will play an important role in getting rid of gum disease by ensuring dental hygiene and having a diet that does not support harmful microbes. Then for bad breath, we will recommend vitamin C, or again, flavonoid complex, as well as vitamin A plus D, and acidophilus, or fermented foods and fiber from our diets. So then I think that, well, I also wanted to mention oral thrush, that is getting a fungal infection in our mouth. These can often be seen in people who have got problems with sugar metabolism, let's say pre-diabetic or diabetic, and also people whose immune system is not working very well. So when you notice fungal infection in the mouth, there's a white coating on the tongue and parts of the mouth. This can be a yeast or fungal infection in the mouth and can alert you to either problems to do with sugar metabolism, or it could be a problem with the immune system. And so maybe to get to the root of what is causing the infection, but also we can supplement with vitamin C acidophilus. If it is a child, we can use Liquivite. If it's a small baby, we can use Liquivite. A toddler or a young child, we can use VitaGuard. If there are sugar problems involved, then of course we can use the products that we recommend for pre-diabetes and diabetes, which is Botanical Balance and 3NN, as well as fiber tablets. So I want to thank you very much for having spent the time with me for this session. I hope that you have found it beneficial. As I said, it is easy for us not to think about our teeth until we have problems with them. But I would recommend that we make it a habit to think about our overall health and how to sustain it. But especially when we think about our mouth and all the ways in which we use it and how important it is in many aspects of our self-confidence and our ability to eat, our ability to speak. It means that our oral health is a very important aspect of our general health. And so if we come across people who maybe need this information, I hope that the session today has given you some food for thought and prospects for how to speak to people you come across. Maybe the person has bad breath. Instead of shunning them and turning away from them, maybe it can be an opening for recommending to them some of the things we have talked about. So thank you very much. Pascal is right here waiting to take you through the business part